Good afternoon and welcome to Pay Entry's weekly webinar. Today's subject is requiring COVID vaccinations at work. I'm Kathy Graham, head of the HR services team, and my associate Brianna Grimes is going to be manning the question booth today. You have a place on your screen to type in questions and we will answer those at the end of the session. Just a few notes, this session is being recorded and will be available probably by tomorrow afternoon on our website, www.payentry.com/webinar recordings. Also, you have as a handout today in your on your screen a PDF of this presentation so that if you wanted to print it out and follow along, you can. So let's get started. So, requiring COVID vaccinations at work is a big topic right now because people are coming back to work and there are vaccines available. Currently there are two, maybe three drug manufacturers that have distributed the COVID-19 vaccines in the US. Outside the US is different. There are different manufacturers and different providers. Right now in the United States, they're primarily available to healthcare workers, those who are first responders, maybe nursing home residents. I saw in our state of North Carolina, if you're over 75 in North Carolina, they're giving the vaccination to that population also. So it does depend on the states because they are the ones distributing the vaccines at this point in most cases. The projection for common release to anyone who wants the vaccine is early summer. So we have a ways to go in thinking about whether or not this is something you want to require of your employees. Another thing I will tell you before going any further is I am not an attorney, and those of you who know me know that I will give you my opinion, but it's not legal advice. So just remember that if you do have a situation or you do decide to go through with a mandatory plan, then I would run it by counsel to make sure that you've dotted all your I's. So can employers require that an employee get vaccinated as a condition of employment? That's the question that's going around right now. And the answer is it depends. A lot of times in human resources, you'll use that reason because it does depend on different factors. In this case, it depends on the current OSHA guidelines. And the answer is yes, unless an employee requests an accommodation due to a sincerely held religious belief or a current disability or a disability of any sort. So OSHA says that you can require them to be vaccinated, but if they need an accommodation, you have to offer that. So in most cases, you're going to find that the answer to the question, because you don't have anyone who would need an accommodation, would be yes. Now, do you want to do that? We'll talk about that in a minute. If someone comes up and does want an accommodation to their beliefs or their disability, then you would be reviewing the requests and engaging in the interactive process that's required under the Americans with Disabilities Act. This is a very fact-intensive uh, process. So it is time consuming and can be very tedious to get through. It requires a lot of preparation and policy in force. And the options for accommodation are not limited to, but could include allowing the person to remotely work, to reassigning them to a different position or a different area within, physically within the organization or the company. Or you could have increased social distancing for this person and continued wearing of face masks. So those are just a few of the accommodations. So there are some relevant factors that you need to consider when you're implementing a vaccination policy. First of all, how it's going to impact your employee morale. If you have an ultimatum, you have a vaccination, you get a vaccination or you don't work here, how's that going to go over with your population? The results could be sincere resentment for asking them to do something that they don't feel comfortable doing. And then there is always the risk of legal challenge, not based on disability or need for accommodation, but maybe a class of people who feel that they may be more at risk of after effects and challenge you from a group perspective. Right now, only 58%. I read 64% this morning too. Only about half of the people in the United States would get a vaccination right now if it was available to them. And the concerns are that there was a rushed timeline for development of the vaccine. So that in turn makes people feel a little uneasy about the safety of the vaccine. Um, some people just don't get vaccinated for other things and have a general distrust of vaccines. And then the doubts about the effectiveness. Now, me, I'm going to be first in line because, I'm of the era that got polio shots and um, smallpox vaccinations and things of that nature. So I guess I'm one of those just herd mentality, get in line for things. But I really would like to be able to feel more secure about going out and not exposing other people to something that I have that I don't know I have. But there are some doubts out there about the vaccination. And so that's going to take a while to dissolve. One of the other things that you have to consider when you're putting a policy in place is the discipline and the enforcement of this policy. Are you really willing to terminate somebody who refuses to get a vaccination? Um, what if one of your managers won't get a vaccination, or your top 3 to 6 people refuse to vaccinate? You need to be able to say that we will terminate if you don't vaccinate. So otherwise, the policy will not stand. If you're not willing to terminate someone, then consider a policy that strongly encourages vaccination instead of a mandate. And I think that this is the direction that a lot of companies are going in. From what I'm reading, only about 40% at this point in time look to a mandated vaccination. And I would think a lot of that has to do with healthcare, first responders, and that industry or those industries. You can always create a wellness incentive for those who opt in, and that probably is the way that the majority of companies will go, is to create bonuses or some kind of an incentive for people to want to go ahead and get the vaccination. Then again, when you're putting in a policy like this, there's an administrative burden. If you're going to require everyone to have a vaccine if they work there, then you're going to have to verify and document vaccinations. You're going to have to establish protocols for record keeping, and you're going to have to track any accommodation requests that come forward and all the documentation that goes along with that. So this is something that you would need to be concerned with because of the time frame. You'd also need to implement discipline policies so that it's very clear that if what happens if someone is asked to take a vaccine and doesn't. And then there are always confidentiality issues to deal with, protection of the files, protection of the information, and any kind of a legal action that could be taken if you don't protect that information. This poor guy, I thought he was so funny. That's why I used him. So what if somebody has a side effect? You've required them to get a vaccination and they have a side effect, because sometimes mild symptoms may occur. What's going to be your policy on time off to recover from those symptoms as a result of the vaccination? And then on the other hand, what if they have a serious reaction? Is your workers' comp policy going to cover that, or would you end up in court with a tort claim? You need to check your insurance policies. That would be your workers' comp and your liability policies for coverage of those types of claims. And then another thing to consider is remaining aware of what's happening on the legal forefront. There will be new recommendations from public health authorities, and federal and state agencies will be addressing this as we get deeper into it and people have more concerns. I'm sure California will come up with something shortly after people start to make vaccinations mandatory that will create some issues for California employers. But this will be addressed at different levels within the United States, and so the legislative and the regulatory side of this are still uncertain. So what should you do to prepare? Okay, we like to end up this way so you have kind of a path to go down. Well, first of all, you need to document your business justifications for a mandatory policy or substitute a policy that encourages vaccination. That's the first step. You have to, management team has to be on the same page. You have to come up with a decision and a justification for that decision. Then you need to implement new policies. If you're mandating vaccinations, develop policies for administration and enforcement. Make sure that you have every bit of the information taken and held in a confidential manner. Create a procedure for reviewing accommodation requests. Who will do that, and what's the procedure, and what forms do you need from the individual? And then develop employee communication about the program. Your employees need to know what the rules are and what happens if the rules aren't followed. And then as a result, you develop a disciplinary policy that would include whether or not the person could continue to work for you if they're not vaccinated. If you're not mandating vaccinations at work, then create a policy and some incentives to encourage people to get the vaccination when it's available. Make sure that if you want them to get it, you might want to pay for it, or make sure that the insurance company that you've selected will also pay for it. You need to design an in-depth communication strategy so that you're supporting vaccinations overall, this one in particular, the reasons, the safety issues and things, all of those things that will make people more comfortable with the program or the program of vaccination. Communicate with your employees. This is on both levels. Develop a positive campaign to provide information on vaccines. And bottom line, make sure that everyone on your management team has been properly trained so that they can address any questions that come up from your employees about your policy, why you decided to go in that direction, and what all the ramifications of each one are. Also, if you have a mandatory vaccination policy, again, review your insurance policies with your broker to make sure that your you have workers' comp in place and that you have adequate liability coverage for any court claims that might be coming up as a result of that. And then bottom line and last, periodically review your policies and your procedures to make sure that you are responding and changing your program based on current law. That's one thing that we've noticed with COVID over the year is that things do change from a public policy perspective. So it is important to stay in tune with what the EEOC is saying about this, what the CDC is saying about this, and what government agencies are offering as far as guidelines. So do we have any questions?
All right, Kathy, we have a couple questions for you. So the first question is, what about requiring vaccinations for independent contractors? How do we handle that?
I think in the same manner, you can require them to have a vaccination if they're coming into your workplace, and be prepared not to use them, though, if they don't have them. So you would treat them the same way that you would an employee in that respect. If you
Okay.
are paying them something to do a job, then you can have certain requirements surrounding that.
Okay. And second question that we have is, what are the issues around asking about vaccination status as a part of the hiring process?
Now that gets a little tricky. Um, if you're going to make it a policy that you're not going to hire someone that doesn't have a vaccination, I would just make that statement up front. I would not ask everyone before they're hired whether or not they have one, because you just make it clear up front that it would be required that they have a vaccination if they're made an offer and they accept that offer.
Okay.
Brianna, you have anything to share on that? Any feedback?
No, I think you're right in that regard. It just should be very well known. I know on some platforms that they will, like for example, I think on Indeed and stuff like that, you can add some pre-employment questionnaires where they'll ask, do you have a degree or have you completed this much schooling or do you have reliable transportation? I would even caution against adding that in as a prerequisite question.
Right,
Have you
right.
been vaccinated?
Mhm,
Just
mhm.
make it very, very obvious in the job description and in the description there that you won't be hiring anybody who does not have the vaccination, and kind of go from there.
Right, because if you start asking medical questions, and that's considered a medical question,
Yeah,
prior to hiring someone, and you don't hire them, you run the risk of someone feeling they're being discriminated against because they don't have it. So I would say post offer, it's fine. Statement up front that you don't hire anyone who has not had a vaccination, and that they would be required to provide proof of that if they're made a job offer and accept. So, um,
definitely.
any other
Okay.
questions?
Yes, we have a couple more. So this one's a little bit more specific. So we are a healthcare company and we service assisted living and nursing homes. If those specific facilities do require staff to have a vaccination in order to enter the facility and our employees choose not to, could we require it as part of the job description?
Yes, you can require it. If you're in a healthcare facility and you want all of your employees to be vaccinated, you do not have to employ them if they don't have a vaccination, because they're coming into close contact with others. So it can be a requirement of the job.
Okay. If you encourage employees to take the vaccine instead of mandating it, do you still have all the liability that you would if you require it?
No, your liability is only there if you require it. If you encourage it, you're fine, because they have the right not to do it. So your liability um, is I don't want to say your liability is never zero, but it drops way, way, way down. I mean, because you're not mandating that they do something that they don't want to do.
Gotcha. Okay. What are employers requesting as proof of vaccination? So if they mandate it, what can they request for proof and documentation?
Well, there's probably something from their doctor. This is new right now, and the masses have not been offered the opportunity of a vaccination. So I would say that something, a doctor's note or something from the doctor that shows that a vaccination would be sufficient.
Okay. And many members of the population may not have the ability to get their vaccination until June or even later. Based on the current rollout plan in the United States, with this in mind, when can we safely put a policy like this into effect requiring it?
I think that depends on your location, how the rollout occurs in your state and in your counties. I would wait until it's available to those. You could start encouraging it now in a policy, that when it becomes available, you would encourage them to get the vaccine. If you're going to put in a mandatory policy, though, you need to wait until it is readily available to the masses, and that's probably summer of this year. But if it's a voluntary thing, go ahead and start your policy now. Gives you time to um, communicate before it's actually available.
Okay. And then we have one last question. Are there any sample policies that we can use as templates at this time? I know we'll need to check with our local state guidelines, but is there something that we can use to get started?
Yes, there is, and we will post it on our website um, under employer resources so that you have access to that. If you want it sooner than that, then go ahead and shoot me an email and I will send you a copy of it.
Perfect. There are no other questions at this time, Kathy.
All
That's
right,
it.
well, thank you very much, everyone that attended today. Brianna, what is our next Thursday? We have another webinar and it is, Brianna will be presenting. And what's the title of that one, Brianna?
So next Thursday is going to be a California specific webinar. We are going to be talking about all the leaves of absences in California. So we're going to talk about FMLA, CFRA, and ADA, as well as the Paid Family Leave Act. However, if you do not work in California or you don't have any employees located in California and you want a little bit of a refresher on FMLA and ADA, it's still going to be a really good webinar for those of you who want a refresher course on FMLA and ADA because those are federally mandated. So there's really nothing specific to California on those two. So definitely if you work in California or you have employees in California, I would highly, highly recommend this webinar. But if not, and you want a refresher on ADA and FMLA, it's also going to be chock full of good leave information.
Okay, and everyone, please remember that we're here, both of us, if you need any assistance with any HR issues, you're welcome to call us. We're happy to help. Thanks for coming today, and we'll see you next week.